I'm Dr. Hale, and I love TMJ, and I love Invisalign. So my intention is to get a lot of the mystery of TMJ out, and also to kind of bring to light a lot of the amazing things that Invisalign's been doing, especially the last couple of years. Invisalign's been around for a long time. So what I've noticed is, after treating like 1,200 patients, that there's just a lot of misunderstanding, not just like in the patients, like what they're going through, but then in the healthcare community in general. So what happens a lot, and it's not great, is a lot of times I'll meet a patient and I'm like the fourth, maybe fifth, maybe sixth provider they've seen. They've seen their PCP, their general doctor, they've gotten maybe a referral to maybe a ear, nose, and throat, and they've just been bouncing around. And so by the time they get to me, a lot of times they're tired and they're frustrated, right. And sometimes their spouses don't even understand them. And anyway, so trying to get the word out, and it's something I'm super passionate about. Love it.
So what would you say TMJ is? What does TMJ stand for? Like what?
Yeah, well, so super technically, TMJ is really the anatomy or the joint. So we actually have two of them. We have a left and a right. And TMJ is the jaw joint. Or more specifically, it's these fancy words, temporomandibular joint. It just means head, temporomandibular jaw joint. So TMJ. And so actually everyone has two TMJs. But in common speech, like if you're at a family picnic, you might have your aunt come up to you and say something like, I have TMJ. What they are meaning or implying probably is that they have trouble with their joint. And so super technically, that would be temporal mandibular joint disorder, TMJD. It's a lot of words.
Or so that's like the joint that's basically connecting your jaw with your skull.
Yes. Yeah, this joint right here. So the lower jaw moves in relationship to the upper jaw and the cranium.
So in prior knowledge, there's a little pocket that it kind of slips into.
Yep. Yeah. So it's supposed to rotate and slide forward at the same time. There's a little disc that it rides like a train on a track. And what happens very commonly is there's just not enough room, and this part of the bone just kind of gets smashed up into the skull, if you will, and then the little disc kind of gets stuck in front. Yeah.
How common is TMJ? Because I know we're trying to bring awareness for it, but is it like common in a lot of people in like the United States? Is it common in like certain age demographics? Or
to answer that, let me say there's two things that are important. There's signs and symptoms. So signs are things that can be measured objectively. So like 5 degrees, 3 pounds, 2 centimeters, things like that. That's important. And then there's symptoms, and those are things that can only be experienced through human experience. I'm hungry. I feel nauseous. I feel scared. I'm happy. Now, our most common kind of real world experience with that is probably when those two things overlap. For example, like I have the flu. Okay, my signs and symptoms are now overlapping. I have the flu. I feel horrible. I feel sick. I go to the doctor. I literally have a fever. So signs and symptoms are separate and very important, and they tell us different things, but a lot of times it doesn't really come into the awareness of a patient until the symptoms are there. So it's a long-winded way for me to answer your question, which is, how many people have signs of TMJ? Vast majority of the population, 80% or more, maybe even more. How many people have symptoms from TMJ, like it's bothering them, like they get pain, they have headaches? A big percentage, 20, maybe 30% of the whole population.
Wow.
A lot of those people just.
That's a lot of people.
It's a lot, though. That's a lot of people.
Would you say TMJ is some kind of like, whenever you get sick and you feel your joints are aching, would that be maybe an indicator, like you don't even know you have pain? Maybe because I know you mentioned the flu. It's been heavy flu season this year. A lot of cases, pretty bad cases. Yeah. But is that something like, I haven't even noticed jaw pain, but I just got sick. I've noticed like I've just been really sore, achy in my joint. Is that like, could that even be an indicator?
Yeah, absolutely. So what'll happen is that when we have something that's going on like systemically or the whole body, like I'm sick, everything's worse. Everything's worse. So that happens very frequently actually. So I have something that was kind of not great, like in this case my TMJ, and it's been okay. I've been going through life fine, but now that I'm sick, I don't have the bandwidth. I don't have the emotional bandwidth. I don't have the physiological pain bandwidth, and all of a sudden things are hurting that weren't there before. Yeah, that's a great observation.
I was just wondering because I know you mentioned flu, and I was like, when I'm feeling the flu, like everything, literally everything hurts. I imagine if you are struggling like with TMJ pain, like that probably radiates even more. But.
Oh yeah, and it intensifies pain. Yeah, if you're not feeling well, then so if something was like a pain stimulus of 2, say 2 out of 10, but then if you're sick, that all of a sudden that's a 7 or something like that. Yeah. You know, it's interesting. You saw about flu season. So there's a big overlap between breathing situations and breathing disorders and TMJ.
Really?
That's another podcast, I think. But what happens a lot is when people have trouble breathing, they're going to have more TMJ problems.
Mm-hmm.
So it's very interesting that when there's like seasonal allergies will kick up, I actually get more patients coming, and so do ear, nose, and throat doctors. It's a pretty common phenomenon. Well, the good thing, or the bad thing about living in Bexar County, I love South Texas, is that there's actually 4 big seasonal allergens that happen every year, and they happen in consecutive months. So all 12 months of the year, someone is having a bad seasonal allergy season, unfortunately.
Yep, every year.
Yeah.
Would you say that people that figure out they do have TMJ come in for other symptoms or like a checkup, do you say that's normal for people? Like someone coming in, like do you think that you find TMJ as more of a, like you have this while trying to fix something else?
Oh, absolutely, 100%. 100%, that happens. So I'll see the signs almost always way before the symptoms.
Mm-hmm.
In fact, a patient came in today, 9 a.m. this morning, and she came in for TMJ. It's just how we have it on the schedule.
Yeah.
So, I go and obviously I'm talking, and I'm talking to the patient for a long time before I even start doing anything, clinically. And her main concern is pain. Okay, absolutely. But I'm already starting to see signs just talking with the patient. And so then I start to do a little more kind of surface level exams. I'm just looking in the mouth, I'm just feeling. And I'm noticing quite a few things already now. So she actually has both TMJs were out.
Wow.
Displaced. She couldn't open fully. She had clicking and popping. I could actually feel it just from my fingers.
What is like the biggest indicator of, is it like you can't open your mouth fully? Is it the popping? What's like the most common, like you can tell this is probably one of the biggest indicators of TMJ, and I can see it clearly with you right now.
I'd say probably the presentation of the teeth. So like, are the teeth crowded or spaced? How the teeth are oriented to each other? Is there forensic evidence of damage to the teeth? How they fit together? I want to circle back on that previous with the patient. So there's a lot going on. So me as a doctor, I'm seeing a whole bunch going on in the patient. But then I learned the hard way early on in my career that sometimes there's patient ideas and there's doctor ideas. And so I start talking to this patient. And so to make a shorter story of all this, the patient's main concern by far and away was the pain. They weren't nearly as concerned with the things I was noticing, that they can't open all the way because she had felt like she'd been that her whole life, or the popping and clicking and things like that. So then I was able to have a conversation with them about what's most important. And so that really helps drive our treatment goals. This patient wasn't coming to me saying, I want to be, this superhuman 18-year-old Olympic athlete. Her main thing was the pain, and we could deal with that. So that's very helpful in tailoring what we're going to do based on what the patient's experiencing.
I think that's people's main like fears of hospitals and dentistry is that they'll find more problems with going there.
Right. Yeah, that does happen. So, but that's okay. So, I think in medicine, in all medicine, GI, family medicine, infectious control, everything, I think a better provider of medicine is going to do a good job of just bringing awareness to the patient, but also trying to see where the patient's at, what's important to the patient. Yeah, I hear what you're saying, and I've experienced that myself as a patient, unfortunately, and it doesn't feel great.
Yeah.
It doesn't feel great, and you feel like you're being sold to or being
There's just
directed.
extra steps. I got to keep doing this.
Right.
After you fix this, I got to fix 2 more things.
It's like
Right.
going to mechanic for like an oil leak, and they figure
Yeah.
out that you have 10
I
times
got to
more
replace
things
my whole
wrong.
engine.
Yeah,
Yeah.
yeah. No, I what I try to do, what I think is a much better service, a much more human service, is trying, taking the patient from where they're at, their awareness, and trying to maybe show them the overall picture, but trying to educate them on like a hierarchy of what's important, what's not, et cetera, et cetera, et cetera. Because it absolutely does them no good if you come in and you overwhelm them and
Yeah.
they just don't come
Just
back.
makes them not want to come back.
I've heard horror stories that a patient will come in, and they're coming to the dentist, and they haven't been in 12 years because of pain, because of embarrassment, because of bad previous whatever. When that happens, they should be celebrated. Good job, Joe. Welcome back. But what I hear a lot is they get a lecture. And like, that is not helping your patient.
Yeah.
That is not going to help them. That's going to make it worse. So yeah, it shouldn't happen, but it does happen.
I figure that probably is kind of a big kind of thing in,
Healthcare.
just healthcare. Being a doctor is kind of like the hospitality aspect of it.
Oh,
Like you
it's
kind of
huge.
want,
Chair side.
yeah, you want them to know, I'm coming to you because you're just trying to help me. Like I can connect with you. I'm not just gonna
Yes.
hear, like you said, a lecture. I'm not just gonna
Yes.
be
Yeah.
told how
The-
I haven't been flossing and you are gonna end up with gum disease
Yeah,
in
yeah.
like 3 years. Like you want like that connection kind of with your provider. So
Yeah, it's like the doctor should be the hired professional, not the moral police, not the guidance counselor, not the whatever, but just they're helping because this person's coming in, paying for it. And yeah, absolutely. And we sometimes in medicine forget like the whole human element to it, which is just huge. Yeah, chairside manner is what we'll call it a lot, and it's a huge, huge, huge thing.
So another thing I know you have shown us before, but maybe for some of our viewers that maybe need that more visual sight, but when you're looking at TMJ,
Yeah,
where exactly
Yeah.
is that, and like
yeah.
where does it start affecting, and when it starts looking bad, where like your indicators?
Yeah, so we have an adult skull, or size of an adult skull. And so we have the lower jaw here, the mandible. Now, if we look right here, this part of the bone is called the condyle. And it sits on a disc or a piece of cartilage right here. And that, and the muscles and the innervation and the capsule and everything is considered the joint. So this would be the left TMJ. There'd be a right one here, and the model doesn't quite show the same. Now on this model, this piece of plastic, this cartilage is super big. In real life, this disc that I'm pointing to is 2.5 millimeters. So everything else is in proportion, but this piece of plastic here is just super
Just
big
help
so you can
show.
see it. Yeah, and then what will happen most commonly is it just simply gets kind of stuck like that. And it feels about what it looks like, unfortunately.
Yeah, that looks very uncomfortable.
So yeah, when that happens, then we can have pain, which is painful. But then we can also have loss of function because it can't open. This thing is wedged. And then loss of function actually will have a whole bunch of consequences on its own, including more pain. It'll just start rippling through the body sometimes. So it's very, very common. The signs of TMJ, very, very, very common. And the symptoms are still common. Like if it's like say 30% of the population, that's a lot of people. But the thing that I get passionate about is of those people suffering, the vast majority of them don't even know why it's going on. I mean, fortunately with the internet and everything, it's a little bit easier, but there are just so many times patients don't understand, and other doctors, we don't understand how this patient's neck pain is related to the TMJ, or how their migraine headaches relate to the TMJ, things like that.
So like there's so many other things other than just jaw or tooth pain
Oh yeah.
that
Yeah.
can indicate TMJ.
Yeah.
Like there's so
A lot
many
of causes.
Yeah, there's a bunch of different bodily
Which is
effects
different.
that are
Yeah.
actually TMJ.
Yeah. There's a lot of different things that can happen to the body. Well, I'll just run through from head to toe, just briefly, the more common ones that are associated with TMJ problems, and that is obviously pain in the jaw joint or pain in this area, noise, popping and clicking. Sometimes they can feel it. Sometimes they can actually see the joint moving.
Really?
Headaches are very common. Pain that starts right here is very common. Pain that starts right here, pain that starts up here. Migraines can happen, which is a different type of headache. You can actually have pain behind the eyes. You can have a lot of ear things happening. You can have muffled noises, reduction in hearing. You can have the opposite. You can have tinnitus, so we have ringing ear or ringing noise in the ear. You can have dizziness. You can have, it's hard to clear my ear, my inner ear, like when I'm on an airplane.
Mm-hmm.
You can have, let's see, muscle pain, we talked about that. You can have a lot of neck problems. You can have swallowing problems. You can feel like my throat, I can't swallow. I got something stuck in my throat. I've had patients that have lost weight because they couldn't swallow, unintentionally lost weight, that referred from other clinics that turned out it was a TMJ problem. We were able to help them out.
Really?
So pretty fascinating. And it goes on and on and on. It goes on and on and on. Posture imbalance, movement disorders, GI issues, sympathetic tone issues. So nervousness, insomnia,
Really?
brain fog, on and on and on.
Just from like
TMJ.
from
The
TMJ.
little thing being out.
Yeah, I have pictures of patients that I'll take before and after treatment where they're not wearing shoes or socks, and you actually see their toe posture change over time.
Wow.
It's pretty.
It's crazy how
pretty
much stuff goes into that. Like just one
Yeah.
thing being displaced can
Yeah.
affect that much stuff.
Yeah, there's a saying in this kind of work: change one thing, change everything.
Yeah.
And it's cool. And you know what I love about that? We see it all the time. So there's like, I have a little pocket of patients who are actually doing Invisalign because their TMJ and their bite is off.
Mm-hmm.
And one of their main focuses is just health and vitality, living better and living longer.
Yeah.
And we see it all the time, and it's so encouraging. So I have a patient come in, and we'll be talking like, "Oh, how's it going?" Like, "Oh, it's great. My bite's great." And then they just keep going on. They go, "Dr. Hale, I've lost like 20 pounds. I've joined the social club. I start walking with friends. I got a dog." And this it's seriously, you change one thing, change everything. You have all these ripple effects that come from helping them out, and it's like the most rewarding, encouraging thing to do.
I know there's a big thing. We've touched on it before, but I know that vitality versus longevity is like a big thing that you can kind of connect with TMJ. Like you come in and you don't want, of course you think about living a long life, but you want to live a full life. You want to live like in the moment you're happy, everything is going well, and TMJ can kind of affect your vitality in a lot of unseen ways.
Yes. Yeah, it's pretty interesting. So there's a lot of interesting science in the last 10, maybe 20 years on longevity. So longevity is living longer, literally adding more years to your lifespan. And then probably more importantly is vitality, living well, being functional, not being sick. So those are both important, but if you had to choose one of the two, probably, you'd want to have the vitality.
Mm-hmm.
Unfortunately, what happens a lot of times in North America is that, unfortunately, a lot of times the last 10 years of life is just not great. Mm-hmm. Sometimes it's chronic diseases, debilitating diseases, and all that stuff. So very interested in that myself. And there's a lot of science on it. And a lot of the science is stuff you would probably think, oh yeah, common sense. Okay, stay socially active. stay physically active, watch what you eat, get enough rest, drink water. But then there's some other things that are coming out that are really, really cool. So one of the things, I'll get to the TMJ in just a second. One of the things that's come out is that there are things you can do to help cognitive function, to help brain function as we age.
Mm-hmm.
And there's a lot of different little things that can be done, and I think the games and stuff.
Like brain teasers.
Yeah, but the number one thing, significantly, by far and away, to increase the vitality of cognitive health as we get old, is physical exercise. Staying fit is the most important thing you can do for your brain.
Mm-hmm.
It's pretty amazing.
Really?
Yeah. So there's a lot of it, and so it's very interesting that Aristotle was commenting on this around 250 BC.
Long time ago.
That was a long time ago. For some reason, I thought those guys were like the Dark Ages, after the Rome fell, but this is way before. This is 250 BC.
Long time ago.
And the dude was a genius. So, but he noticed four things in humans that lived to old age and still had vitality. He noticed clear eyes, firm handshake, good posture, and all your teeth. And it's true. So the clear eyes, I believe he's talking about metabolic things. A lot of things can show up in our eyes.
Mm-hmm.
I don't think he's talking about 20/20 vision, corrected vision. All right. Firm handshake has to do with muscle grip strength and overall activity level,
Physical health.
and health.
Yeah.
And then the posture and teeth are two components of the same thing.
Mm-hmm.
And it's interesting. I have several patients in their 90s, and they're very vital. They're very full of life. They're very amazing. And I tell them the story, and I look them in the eyes, I shake their hands, and they all do have a good handshake. It's pretty interesting.
That's never something I really thought about, is having a full mouth of teeth will affect your vitality.
Oh, it's
in
crazy
life.
important.
How they tell you how important your dental hygiene and upkeep is, but you don't think super long term on that.
I'd like to we'll have an episode in the future just on posture, movement, and TMJ.
Okay.
Some pretty amazing stuff. So one of another small subset of my patients are patients 70 years old and older that are into vitality, as well. And there's like a group, they know each other. This group is growing. It's pretty fun. And they all like to walk, and that's what they do. They go to Eisenhower Park in San Antonio, and they walk. And so they come to see me, and we're talking, for them, it's about balance and not falling and staying active. And it's just super important. It's amazing. Yeah. Teeth are important in longevity, certainly to chew. And certainly there's a psychological, social benefit of being confident in your smile. And I love that stuff. There's actually so much more. It's crazy. It's interesting.
Would you say there's a controversy around dentures?
Kind of. What do you mean by that?
So I know that certain things, like obviously having your full mouth of teeth, would you say that having dentures would affect your vitality?
Oh, absolutely. 100%. Yeah, unfortunately.
Negatively. Negative way?
It'll take years off your life.
Really?
Yeah.
How
Now,
so?
you have to weigh the whole person and what was going on at the time. I mean, there are just medical situations where, look, we got to take these teeth out. And having dentures, your life and your vitality is going to be better than someone who has no dentures at all, for sure. But yes, you do. You lose quite a bit. You lose quite a bit when you don't have natural teeth in there.
So I have a question, because I know it's kind of more of a, maybe not currently, but in the past few years, it's been more viral for younger people to completely take out all of their original teeth and get veneers.
Yeah.
Really?
Yeah. Oh, yeah. I even saw something
Yeah.
recently, I think here in San Antonio, there was a not certified dental practitioner where she would pretty much unlawfully take people's teeth out for cheaper and put in veneers, and they would get infections, and they would go and see real dentists and doctors and be like, you did not get this.
Yeah.
You did not go to a professional for this.
Oh,
And
no.
they were like actually bad health problems. It was reported on the news. But that's a big thing now with a lot of young people. They want clearer,
Perfect
that
smile.
perfect smile, that doesn't even look completely natural. It just looks all white, all straight, and they get it done in their 20s and 30s.
I feel like it's maybe just like mostly people that want that social, like they want to be perfect. They
Yeah,
don't
they
want
want
to
that
be seen as
Hollywood
something they're not,
mouth.
and
But-
they don't want to do the work for it.
But you're
They
saying that will affect your longevity in the
absolutely.
long run. If
Yeah,
if
yeah.
you get veneers at a young age,
Well,
you-
not necessarily getting veneers, but having your teeth removed.
if you get all your teeth
Yeah.
removed.
And of course, if the veneers or the bad dentistry leads to the teeth failing and teeth, being extracted.
I gotta find like the actual art. Well, I saw that on like KSAT or something, and they did a full reported story.
We need to have a podcast.
That could be
about
a whole
Yeah.
episode, but it was crazy.
Wow, that's crazy. Yeah, so when it comes to vitality, assuming a person is medically well managed, like basically you're decent medical health, you don't have uncontrolled diabetes or something, like you're reasonably healthy. The next most important thing for longevity is diet and nutrition.
Right.
It's nothing cool about that, but it is what it is.
Basics.
If those two are good, the next biggest thing you can do is look at a patient's bite, their occlusion, because the jaw is actually part of the neck and how it functions. And it has to do with spinal cord health and balance and on and on and on and on. So
just ties into everything.
yeah, we don't want to lose our teeth, and we certainly don't want to lose them early.
Okay, good to know. I had that. I was wondering about that because I remember seeing that specifically a while, because it's like one of the more popular things that a lot of younger people are doing unnecessarily too. It's like you have perfectly fine teeth, and I'm just gonna get veneers because I want the perfect smile.
Think about this from your own common experiences. The relationship between teeth and posture over a human's lifespan. So we're born, we're newborns. Eventually, you have a young child too. Eventually, we can start doing some tummy time or spine. We can start lifting our head. Our head at that age, the head is huge compared to the rest of the body. Coordination starts increasing. And around the time when our teeth start coming in is around the time we start learning to walk. But even when we're walking, of course, we have a huge head too, but we don't have any back teeth. It's very unstable gait, very wide, very slow, very clumsy. As the body matures, as the teeth start settling in, all that evens out, works out, and we get to, we have our health in our mid-20s, right? Okay, then we fast forward several decades in life. If unfortunately, for whatever reason, we haven't had access to dental care, or for whatever reason we start losing our dental health, we start losing our teeth, and you probably have experienced this or certainly seen it, as we start to lose our teeth, one of the things that starts to happen is we start to develop a little bit forward head posture as it kind of goes like this, and that'll ripple down the rest of the body to the shoulders, to the hips, to the legs, to the feet. And then you'll notice, as unfortunately, when this starts to happen, especially like if a patient doesn't have their teeth in older age, is they start reversing that movement pattern that we had when we were first born, where the gait starts getting wider, the gait being how wide my feet are, becomes more unstable, slower, clumsier, and yeah, it's just this, we just go back to where we started.
So let's say you went to a convention, and maybe the topic of the convention is a little more for the older age group.
Yeah.
If you were walking around, you could potentially tell someone's dental health and or how their dental has like progressed based off of like how they're walking around. Like if they're walking around really wide set, kind of more postured down, compared to someone in the similar age group, you could tell, okay, they've been taking care of their teeth, they haven't.
Yeah.
Really?
Yeah, the body is, or the posture is the body's expression of the bite, of the occlusion. Certainly there's differences in nuance, but yeah, what you're seeing in the body, it's presenting itself on what's manifested in the occlusion. We'll get into more later about that, but the teeth and the TMJ affect the neck. In fact, the body sees the jaw as part of the neck. It sees it functionally, it sees it with the neuroanatomy and the neurophysiology, how it works. It does not see the jaw like it sees an arm or a leg or a toe. It actually sees it as part of the neck. So yeah, your teeth actually are critical.